Qualified, professional, and compassionate doctors talking real solutions to real health problems.
The liver is one of the most important organs of the body. Much as it's very important to the body, it is subject to a number of injuries, including alcohol, drugs, and infections. Tonight on the DocTalk show, we discuss an infection that disturbs the liver and can result into serious injuries. We are discussing hepatitis B infection, a very common illness, probably much more common than HIV in our setting. And with me in the studio is Dr. Amon Jackson, the Commissioner of Clinical Services from the Ministry of Health Uganda, to help us understand what exactly hepatitis B infection is. So welcome with me to the show our guest speaker, Dr. Jackson. You're most welcome to the DocTalk show. And I am your host for the evening, Dr. DARIUS OWACHI. So let's dig in to understand more about this very common infection that disturbs very many people within Uganda. So Dr. Jackson, thank you for sparing the time to come onto the DocTalk show.
Thank you.
And just as I said, we are discussing an illness that has caused a lot of panic to so many Ugandans, hepatitis B.
True.
Everyone is worried about hepatitis B. And when people are worried, sometimes they get the wrong information. So we want to help the public understand what exactly is this hepatitis B. Why is it causing so much fear and havoc among us Ugandans? Maybe we would start us off with understanding what this illness is about, this hepatitis B.
Yes, thank you so much, Darius. Hepatitis B is an infection by a virus, and it causes sourness or inflammation of the liver. And when this liver is inflamed, then you can be getting some of the symptoms that are commonly seen in many of the patients.
Just how common is it in Uganda?
In Uganda, we had been doing some research, especially we have been testing people who have been donating blood. And the first test which we came out with, which was not really very scientific, we got at an average of about 10% of the population having hepatitis B. But later on, we had the sero-survey study, which was covering the whole country. And when we got the results, an average came to about 4.2%, between 4.2 and 4.6% as the average for the people, the population that have hepatitis B. And it has become common talk these days because earlier on, people could die, you would not know whether it is hepatitis B. But now, because we have been talking about it on TV, we have been talking about it on radio, and we have been testing people. There are so many tests which we have now, testing centers, so you can have the results and you know that you may be having hepatitis B. And that's why it has become very common talk, and everybody is now concerned.
Yes, and according to that national survey, there are different regions of Uganda which have different levels of this hepatitis B. For example, in the northern parts of the country, they found what they call the prevalence is how they measure disease. So they found the prevalence was up to almost 20%. So there's geographical variance in this disease. You may find Kampala has a fairly low prevalence of the disease compared to the northern part or to the western part of the country. So it is, I agree that it's a fairly common, very common illness in Uganda. And the fact that it affects the liver, I think that's what makes people worried, because one of the common complications it's associated with is liver cancer. Yes, but is it that every patient will get this liver cancer if they get hepatitis?
Yeah, you know, we need to begin when we are talking about hepatitis B. We need to know how can one acquire hepatitis B. And the commonest route of getting hepatitis B is when we get in contact with maybe somebody whose blood is already infected with hepatitis B. So blood, when we get, you receive blood from somebody who has got hepatitis B, then you get in contact with that blood or fluid of a patient who has hepatitis B, then you get infected. The second common route is transmission from mother to child. A mother who is pregnant and she has hepatitis B, definitely there's a very high chance that she will deliver a child who is already infected with hepatitis B. The other route, which is very common, is sexual intercourse. When you have sex with somebody who is infected with hepatitis B, you will also get it. Another route is when you get pricked with unclean instrument, like if you are going to make tattoos, you're going to prick pierce your ear with somebody who has already used that same instrument, then you can get it.
Because there's exchange of
The
blood
exchange of blood or fluid
the sharp
with the
objects.
sharp objects.
So it's almost similar to the HIV.
Same way of
The same
transmission.
way.
But in hepatitis B also, the common transmission is child to child. That you get children playing in a compound, they exchange their saliva, this one is touching saliva, putting in the mouth of the other. It's so common that such children can have transmission of hepatitis
So
B.
it's mainly in body fluids.
Body fluids,
Transmitted in body
the
fluids.
blood. So those are the areas where the transmission can be.
Okay.
Now, after talking about that, then we look at how can somebody show that maybe he has hepatitis. The unfortunate part is the symptoms are very queer. They are not really very distinct. That they show some symptoms which is almost similar to malaria, because they can have fever, they may have headache, they may have vomiting, they may have joint pains, and may have abdominal pain, which are almost similar to malaria. So it is not really very distinct that this presentation or these symptoms are for hepatitis B.
The symptoms are very non-specific.
They are non-specific.
So they can occur in malaria, they can occur in typhoid, they can occur in any other disease that presents with fever.
Yes. So when somebody comes with that presentation, the first thing in Africa that people think of, you have headache, you have fever, is malaria. And they may treat, and the malaria will go, and you think you have got cured. And that is what they call the acute phase of hepatitis B infection. So when you get the acute phase, it may last for about 6 months. So when it lasts for about 6 months, there are two things that can happen. One, the body may fight without even any treatment. The body may fight that infection by hepatitis B. And
the infection clears.
The infection clears, but the good thing that it happens is you develop an immunity because the body has already been exposed to hepatitis B. You get that defense already, what we call immunity. You become immune, so you will not get any other infection due to hepatitis B.
And that is in the acute phase.
That's in the acute phase.
When the symptoms are not specific, and in majority of cases, the body fights the infection off.
The body will fight it, but when the body fails to fight it, it will now continue to become chronic.
The chronic.
The chronic.
That means the hepatitis now stays in the body for a longer period of time.
It has stayed in the body for a longer period of time, and then the destruction on the liver will now be more grave, because I told you when you are infected by hepatitis B, there's sourness or inflammation of the liver. So that inflammation may now turn into some kind of a scar. And you know, when the liver is already traumatized, that is a wound. It will heal as a scar. So when it heals as a scar, now that's the complication now due to the chronicity of the hepatitis B. So that chronic condition will now continue to advance, that it may lead to the liver cirrhosis.
So the liver, that's the cirrhosis to mean irreversible damage.
Yes,
the
irreversible damage. The scarring
liver.
of the liver is what we can now refer as the cirrhosis, or it may lead to liver cancer. And those are now the
biggest complications,
the complications that we can look at as a result of a chronic hepatitis B.
And then progress to liver
such
cancer.
a situation, what you now see, somebody comes with yellowing of the eyes, may have a swollen abdomen, they may have now shortness of breath. You know, there's now a lot of complication that comes due to that scarring because the liver has now got scars and it may not perform the function that it should be performing. You may have somebody coming with swollen legs, and that is now a chronic condition.
The signs of the chronic liver disease.
And that would be very late for the medical personnel. You may not do much when you reach that situation because the only condition where the time when you can do some assistance to the patient is when during the acute
the early stages,
and the early stages of the
can be managed, or if even if they have the chronic stage, it can be monitored, and some people are started on treatment to prevent liver cancer or liver cirrhosis from developing. So again, remember you're watching the DocTalk show. If you have any questions or comments, send it on our social media platforms. You can also subscribe onto our YouTube page, or that is the DocTalk show, and you can watch some of these videos that are uploaded. So after the break, we shall come back and understand more about hepatitis B. And in particular, we shall be discussing the chronic form, because we have learned that the acute form doesn't cause problems. In the majority of people, they spontaneously clear the infection. That means their body gets rid of this infection. In a small percentage of these people, they are the ones who progress to the chronic type of hepatitis B. And it's in this group that that people are more at risk of getting the irreversible liver damage and the liver cancer that comes with hepatitis B. So after the break, we shall understand who might be at risk of getting these infections and more about its prevention. Don't go away.
You are watching the DocTalk Show.